Okay, so in this question, my 65-year-old man who's presenting with a central passing chest pain for the first time. So this patient is immediately taken for primary percutaneous coronary intervention. And then a thrombus is found in the left circumferential artery. Then now the question is, what are the most likely changes to have occurred on ECG during admission? In this question, we have seen that the left circumferential artery is blocked. So in order to answer this question, we just need to identify which side of the heart that this left circumferential artery supplies. And we know that this left circumferential artery supplies the lateral walls. Now on the ECG, which chest leads and limb leads capture the electric activity of the heart? So we know that the lateral wall is captured by the V5 and V6. So from this question, we already know that the likely answer here is the one having V5 to V6. But the question is it an ST segment elevation or depression? So for us to identify if it's a elevation or depression, we need to check in the question. And the question was saying that this patient was transferred immediately to the closest cardiac unit to undergo the PCI. So they show that this was an emergency which required this intervention immediately. And in most cases, this is usually an ST segment elevation. Because a depression, this procedure can be done within 24 hours. So the answer in this question would be an ST segment elevation in lead V5